The advice and opinions expressed by Dr. Granpeesheh and her guests are meant solely as suggestion and should not be in any way construed as child-specific advice.
Dr. Doreen Granpeesheh is the
Dr. Doreen is an expert in autism.
Doreen Granpeesheh.
Dr. Granpeesheh.
Dr. Doreen Granpeesheh.
Dr. Doreen Granpeesheh is a visionary in the field of autism. Now you can ask her questions on Ask Dr. Doreen. Good morning and welcome to Ask Dr. Doreen. I'm Shannon Penrod and I'm here with the fabulous, wonderful Dr. Doreen Granpeesheh.
Good morning, Shannon. Good morning, everyone.
So thrilled to be here with you.
It's wonderful to be here.
Did you have a good Thanksgiving?
I did. It was lovely. Lots of cooking. How about you?
Same thing. Lots of cooking. And it was lovely.
It's such a holiday that is really all about eating. I actually went around and forced everyone at my table to give gratitude for something.
That's wonderful.
Yeah.
We just do small Thanksgiving because my husband has to work on Thanksgiving Day.
That's true.
But so we do small Thanksgiving at night, but we all talked about what we were grateful for too.
That's nice.
So it was really fun. And we hope that all of you had a happy, safe, and abundant Thanksgiving as well. And we're back, and we're going to be talking about challenging behavior today.
Yeah.
Because, probably you had some of that over the holiday. I'm just going to guess.
Yep.
If your life is anything like my life used to be. Let me say that I am so thrilled to be here with Dr. Granpeesheh because she's a true expert in the field of autism. She's been working in this field for over 45 years. I know it doesn't seem possible, but it is. And during that time, she has helped all different kinds of people on the spectrum, whether, from very young babies up through senior citizens and their families as well. She is a wonderful advocate for people who are neurodivergent and neurodiverse, always asking us to make it fair and to think about their needs. But you also include the family in that, about it being fair for the family and their needs as well. And she will continue to talk about that as we talk about challenging behavior, because that's still a part of the conversation. So some things that you should know, you can be writing in right now. We're live right now on Facebook, on YouTube, and we're live right now on Ask Dr. Doreen's YouTube, and I believe also on Autism-Live's YouTube as well. Later on, the show will podcast and be available wherever you get your podcasts, wherever you get free downloads, because it is a free download. You can still, we keep saying, but I think we're really going to be pulling the plug between now and the end of the year. Right now, you're still going to get it if you subscribe to Autism Live's feed, but you really must subscribe to the Ask Dr. Doreen podcast so that you can continue to get. And what happens is that you'll get it every week that we do it, every time there is a new one. So you want to be doing that. I also want to say for those of you who, you can be watching us on YouTube, that's all available. And you can see picture and sound. If you want to see how lovely she looks in her autumn colors and how crazy my hair is, then you can be watching on YouTube. And there's 13 years worth of videos that are there.
Yeah.
So there's quite a library that you can search topics and, see all the questions that Dr. Granpeesheh has been answering over the years. Feel free to do that. But it is available as a podcast as well. And many of you wrote in and said, that you love the podcast, but there are a lot of ads, and we love the ads because that's what helps us to keep the lights on, right? But if you don't want the ads and you are willing to pay a small amount per month, that is available to you as well. You can go to glow, glow.fm/autism-live, and you pay $5 a month fee to be able to get both Autism Live and Ask Dr. Doreen ad-free. Any show that we do here at the Autism Network, you get that ad-free just by subscribing. And here's the thing. It's a low cost of $5 a month, but if you pay it for a year, you can get it even cheaper. We pass the savings of not running your credit card on to you. So that is available to you. Many of you asked for that. You do not have to do that. You can be watching and listening for free. It is available for free, but then you will enjoy the ads.
Yes.
And we want you to enjoy the ads. It's all good, whichever way you want to watch. As I said, we are live right now, and you can start to ask questions. Parker is here. Oh, Parker, I'm so sorry to hear that you're not feeling well. Okay, and I have a question that you sent in last week. But you said you're going to ask one on your behalf later on. Okay. We're sending you a hug and hope that you feel better soon, Parker. And we're saying good morning to Susie. But I said that we were going to start with, did I talk about that where all the places were live? I did. Okay. You know,
It's too much going on.
there's a lot going on,
Yeah.
and I keep losing things.
Well, or forgetting, that's me.
Oh, really?
Oh my gosh, I have zero memory anymore. I always say like my hard drive is full.
Well, I just keep losing things. I used to teach college, and even before I taught college, people referred to me as the absent-minded professor.
Yeah.
Because I'm busy doing something, but in my head, I'm sculpting something. And so I
You
walked
don't-
away from my car and left my car door open
Oh my gosh.
to go into a store.
Or how many times do you lose this, your phone?
Oh,
It's
constantly.
a constant, yeah.
Constant. But
Yeah.
now I've lost my keys.
Oh.
Last week I lost my makeup.
Oh my gosh.
And that I all found, but my keys are still missing. So if anybody, has found my keys, please let me know. Okay. Anyway, I don't know whether I'm coming or going. But I want to start with a question that Parker sent in he found it on Reddit. And normally, we let things that are on Reddit be on Reddit, but Parker said I would really like to help this parent, and that he said he would be responsible for getting your answer back to the parent.
Yeah, that's great.
Okay, and he said, I really feel bad for this parent. The parent wrote, I'm having some issues I'd love some advice about. My son is very high-functioning 8-year-old with some low-level social skills, and I can't remember offhand, but essentially feel and texture issues. Very picky eater, has to wear certain things for comfort, etc. And we are currently in a really bad patch at school. He goes to a really good private school who seem to be very helpful with diverse children. There are a few at the school. However, our son seems to overreact to negative social interactions to the point that he'll run away from confrontations and enter into dangerous behavior, either by entering an area he isn't meant to, for example, a construction zone, or by putting his safety at risk, climbing things he shouldn't, leaving the school area, etc. The last 2 days in particular have been very difficult. He had a situation where a couple of older boys were a bit mean to him, which initiated a similar response to the above, and a call from school to bring him home. And this morning was found with a knife he had smuggled from home. He does struggle with negative comments, so if he gets told off or someone is mean to him, he believes he's the worst kid in the world and nobody likes him, which makes it a little difficult to discipline him, not that he often needs it. He is generally very well-behaved, loving, and affectionate kid. My initial response would be a serious punishment. However, that likely won't work or help the situation at all. We have access and use all possible resources and support, and we'll be looking for some help there as well. Any advice or ideas on how to help would be great. Thanks.
Yeah, there's a lot going on there, and
Yes.
I have a lot of thoughts. I hope I don't forget them, because as you were reading, I had like 10 different thoughts coming to my head about this. No.
Yes.
So, first of all, safety and running away from school, that's the first thing. Like, they need to make sure he doesn't run away from school, period. Like, that is the school's responsibility when he's there. Either the school grounds have to be contained, or they need to make sure they're somehow safe so that he doesn't have the ability. This is important for all kids, actually. Like, I'm very surprised that he can get out of school. I don't know exactly where you are, but in general, for the safety of kids, schools are not open so that you can run off. Like,
I would love to tell you that I'm surprised, but I'm not.
Yeah. So that's
Yeah.
just bad. And like, you need to make sure that that is taken care of. So that's item number one on your first meeting with the school principal. Like, that is number one. Number two for the school principal is they need to give you an aid, period. Because at this point, your child definitely has an understanding of causality. If he didn't, he wouldn't be upset enough and then think, oh, I'm going to take a knife to school to get back at these kids. Like, there's causality there. So cause and effect. So basically that means that it's not about punishment ever. Punishment doesn't really work, and especially when it's a complex situation like this. But it's about making your son understand things a little bit better. And in order to do that, you need someone there. And we're going to talk about some of the things you can do at home too, but
Yeah.
you need an aide who is able to do a few different things. One is try to change the environment before it gets to that final point of him getting aggressive or running away. So there's modifications that need to be made in the school when these types of things are about to occur. So an aide who can recognize, for instance, first of all, if there's an aide, older kids wouldn't be bullying as much. And even if another child says something that your child misinterprets, which is often the case, they would be able to help your child understand exactly what was meant and that it wasn't an offensive comment or action. So that's number two. So number one is safety around the school, so no running off. Number two is actually having an aide present for him. And you might find that it's certain situations, like he doesn't need an aide in the classroom, he needs it on the playground. I don't know, but that's something that you should probably observe and discuss with an IEP team and get it going right away. The third thing is, I think it would be beneficial, all schools, I've seen this and it's very helpful. The schools can do like a small presentation or kind of like an in-service or training for all the other kids to reduce bullying, to increase an understanding of neurodivergence, to help the kids understand that what they're doing is very harmful and hurtful. Those types of programs are available across the country and they're generally helpful. So I feel like this is the appropriate time for your school. If you think that it's a good private school, they should be able to do something like that.
Yeah.
So that other kids are actually supportive and not mean. And let me tell you, there are some cases where I've seen other kids are so supportive that it makes all the difference. In fact, some of the schools that I've worked at in the past, they've set up like big buddy programs where an older child becomes like a buddy or a big brother to a younger child. And it's life-changing. It's life-changing stuff for both sides, by the way, not just for the younger child, but also for the older child who learns empathy and compassion and, you know, all the things that we want our kids to know. So those are some things that the school can do. Now, at home, or I'm not sure if if you're in a behavioral program, in an ABA type program, but there are a lot of things, excuse me, that you can teach your child about this situation. And every situation, it could be seen as an example, so that you can, for instance, sit and let's say the boys say something to him. First of all, you would specifically, you're trying to kind of recreate the situation and make your child see things from a different perspective. Now, it is, first of all, it's entirely possible that the boys said something mean. Okay. And that is something we teach all of our kids, which is if someone says something mean to you, you just need to walk away from it. Don't let it hurt you. It's their problem. It's not yours. That person is not, you don't need to deal with it, etc. Yeah. But it could also be that your child has misinterpreted what was said. I've seen that a lot. Like a child might trip over your backpack, and then our child will think, oh, he intentionally kicked my backpack and get very upset. So teaching our children to calmly analyze the environment, and it sounds like your child is high functioning enough and able to actually perhaps analyze and reanalyze and see things from a different perspective. It's really all about how we perceive things, right? And then number one, helping your child see things a little bit differently in every scenario that occurs. Number two, making sure that your child learns that anger is not an appropriate response to any kind of emotion. So that involves helping your child understand how they feel. Like I feel, I'm upset, I'm embarrassed, like putting there's in psychology when we learn about emotions, there's an emotion wheel, which is very cool because it starts with, like, let's say the basic emotions, angry, happy, etc., but then it breaks off.
Yeah.
And, anger can be lots of different things, including embarrassment or, whatever it might be for that child. So helping your child go a little bit deeper and understanding that it's, other kids also make mistakes, like you don't have to react. Helping them understand more about their own emotions and the other kids' emotions. And we have a lot of lessons on just emotions and how you can control your emotions. So that's kind of one thing, which is you can go to your other room and, punch a pillow or something like that, or yell or whatever, but you don't aggress towards another person. So there's understanding the emotions, and then there's rules about behavior related to those emotions. So we don't hit others when we're angry. These are some of the things, breathing exercises and other things you can do to help calm yourself down. You can journal it. You can talk to someone that you care about it. There's all these, adaptive ways of dealing with emotions, and then challenging ways of dealing with emotions. And then finally, I think your child also probably needs to learn the rules of actually aggressing towards others. And if you aggress towards someone else, it sounds like this little boy would understand that, for instance, he could get into real trouble with the principal if he takes a knife to school. And those are, I think, things that, sometimes it's very harsh, but I think our children need to learn the consequences that could potentially come when they have these types of behaviors. But it's not that he's doing it intentionally. He's doing it just because he's hurt and he doesn't know how to deal with his hurt feelings.
Yeah. Here's what I'm worried about. You say that it's a good private school, and I hope that that's true. And I hope that, you're going to have to call an emergency IEP meeting to go in and talk about all the things that Dr. Granpeesheh talked about.
Right.
And I hope that they're going to listen to you and that they're going to be nice and realize that they've dropped the ball and that in some ways they've let your child down. Mm-hmm. Because what I hear is a little boy who doesn't feel safe.
Yeah. That,
he has to run and go to a construction zone in order to be safe. He has to bring a knife in order to be safe.
Angry, yep.
He's afraid. And he's trying to defend himself, and he's trying to get away from the thing that he feels fearful of.
Yep.
Well, number one, and I'm an ex-teacher, number one thing that we always used to talk about is in the post 9/11 world and the post Columbine world is that when children come to school, they have to feel safe. That we are not going to be able to educate anyone if they are not feeling safe, which means if they're not food safe, this is why we have breakfast programs so that kids can eat.
That's true.
And they got to come in, they got to have their bellies full and feel safe at school.
Yeah.
And whether intentionally or not, this school, the sum total of what they have done is made your son not feel safe.
Right.
So I want to encourage you to go into the IEP meeting and hope for the best, and go in and hope that the principal is going to listen and go, oh, you're right, we need to make sure that he can't escape.
Yeah.
Because I think that hasn't occurred to them before, right?
And we need to educate all the other kids so that they're not bullies. Like, bullying is not okay anymore,
isn't.
and a lot of schools deal with this now.
So I want you to go in and play nice to begin with and say, we really want to work together. Here's what we'd like from you. We want you to shore up the safety.
Yeah.
We want, but if they start talking about, well, we really can't have knives coming to school, then I want you to play hardball.
Yeah.
And I want you to say, well, this was it's not okay. We're not excusing the knife, but this is a reaction to handicap harassment.
Yeah.
And say that so that they go, oh, we got to take some personal responsibility here. The other thing I wanted to add to your list, in addition to making, sure that he can't get out, is I think that your child has to have something. I don't know if it's appropriate. I want your opinion on this. But my son, when he went to junior high, which is a little bit older than 8, his counselor gave him a card that he told him where to stick it in his backpack, and he said, at any point, you can show this card to anyone, and everyone who interacted with him knew that if he showed that, he didn't have to explain himself. He got to go immediately to the counselor's office and stay there until whatever was solved.
That's nice. That's a nice way to do it. And it works, and it's a great idea, but all the other kids have to understand that they can't mock that. Right?
Yes.
Because if they're bullying their child already, then my concern, like, this is all really, has absolutely really nothing to do with this little guy. It's about,
except that he feels unsafe.
exactly, and that he feels threatened and he feels mocked.
Yeah.
And that's, none of that is okay, right?
No.
So basically it's about educating all the other kids.
Yes.
And it's about teaching them to not hurt. I love I had not heard that before. Handicapped harassment or something?
It's the legal term,
Yeah.
and it's actionable.
Yeah.
And if you can prove that your kid was being harassed
There you go.
because of it's actionable lawsuit,
There you go.
massive problem
Yeah.
for the school.
So that is, that's actually exactly what these kids are doing.
Yes, of course.
So that's very important, and I hope that using those terms and being very, adamant about it makes a big difference, and the school is responsible for making a change here. It's not about how your son reacted. Your son would not react that way if people were not making fun of him, if he felt safe, if he wasn't angry, if he wasn't embarrassed, all of those things.
And when you ask for the aid, my fear is that they're going to give you pushback and say, well, he doesn't educationally need an aid. But again, I want you to say that until this issue is resolved, I go back to what we were always taught, which is if I don't feel safe as a student, then I'm not going to be able to access the curriculum. And I want you to drill down on that with that principal and say, my child does not feel safe. And we are seeing, that his ability to be present at school is hampered by this. Therefore, we need you to put an aide there, someone who can help to make sure that it's all happening so that he can. And IDEA says that your child has a right to whatever support will help them to access the curriculum.
Correct.
So, doesn't matter that he can score 100 on a math test. Don't let them push you around. I'm so glad we had this discussion. I get all hooked up. My blood pressure goes. Okay, I wanted to get to Taryn had written in and said, good morning, ladies. Very nice to see y'all. We're glad to see you too. We got a y'all.
Y'all.
I love that. My 4-year-old ASD son has been repeating the same question a few times after I've answered already. How can I help him to stop this? And Taryn, I love you. I have been through this, Taryn.
A lot of kids do this actually, and it's not a bad thing. I know it gets annoying, but it's actually it's a great thing. I see it as a good thing because I think that kids who do this are trying to communicate. They don't understand yet the concept of kind of the content of conversation, which is a question is asked, an answer is given, now we move on to something else, or perhaps question is asked, an answer is given, and a question is asked of the other person, dialogue. They don't quite understand the concept, but they see people talking to each other. And so what they're trying to do is mimic that, and the content just doesn't make sense. So so basically the way to handle it, if you want, is when your son, when he asks a question and you answer it, have him repeat the answer right away so that he just understands exactly what you said. And then from there on, if he asks it again, you don't answer it. So basically he realizes, oh, I can only ask once. And there's lots of different ways.
Bless you.
Excuse me. There's lots of different ways that you can deal with. If he does, thank you so much. If he does ask again, you can basically just, put up one finger. I've already answered it. There's kids who are hyperlexic, and we write out the answer for them so they know that it's been answered. You can ask a question of him to stop him asking. But basically the idea is just to make sure he understood the answer by repeating it, and then you don't answer it after that.
Yeah.
Did that happen with you and Jeff?
Oh, totally. It was always the thing, we'd be in the car and he would say, what's for dinner?
Yeah.
And I would tell him, I'd say, we're having chicken and mashed potatoes. And we get about 3 blocks down the road and he'd go, so what's for dinner? And then there was a great period of time where I would just keep saying, he doesn't remember. I just told him he doesn't remember. It's chicken and mashed potatoes, right? And then we had a BT with us. And they were like, no. Ask. When he asks you the second time, ask him, I just told you, what did I say? Right? And then he would go, oh, we're having chicken and mashed potatoes. Then we get 3 blocks further and he'd go, what's for dinner? And then I was prompted to say, we already talked about that. What else would you like to talk about?
Yeah.
Or what's really going on?
Yeah, totally.
And because he didn't know how to keep the conversation going.
He wanted to keep the conversation going. And that's a very high level that you experienced. And there are kids who are not that vocal and don't have that level of vocabulary who do this.
Yeah.
In fact, if you think about it, this is an advanced or kind of very, advanced type of echolalia, if you think about it, right? And so it starts with that, and echolalia itself, echoing things, is always a sign of, I'm trying to like have some sort of dialogue, or I don't understand exactly, and so on. So if you can make sure by responding, having the individual repeat it, depending on the functioning level of your child, you can also have them write it. You can write it. You can, there's all kinds of reminders that we give kids too. It's like, ask one time or something like that, but change the subject, go on to something else. And if they ask that again in 5 minutes or 10 minutes, just don't answer it. Repeat something else, go on to another subject.
Ask them a different question.
Yeah.
We started saying asked and answered.
Yeah. Or nothing.
Yeah.
Like,
but nothing is hard for me.
It's very hard. It's very hard. I know.
Me.
But extinction, like just ignoring the behavior as much as possible and actually talking about something else, is probably one of the fastest ways to stop it, because the child won't get anything out of it.
Yes, I can't stand the silence. And I think that part of it is that when you guys are doing the extinction thing, you guys know when and how to do it. As parents, we do it wrong 99% of the time.
I don't know that you do it wrong. I don't think you do it wrong. I just think that parents, and I went through this myself with my own kids, it's like when you do the extinction, the first thing that happens is the extinction burst, right? So the behavior increases, then you start questioning yourself whether you're doing it wrong.
But then we give in, and now all we've taught the child is I got to have a tantrum before
Exactly.
And I love, I don't want to speak too much, but there are people that I love and know that now go, well, I just ignore everything that he says.
Right.
And I'm like,
oh,
well,
no, that's not good at all.
That's not the ticket. We don't ignore children, we ignore behavior.
Right.
And it's very hard to understand the distinction when it's somebody you love. So that's why I don't like the silence.
Absolutely.
Not because I don't think, I believe it. I see you guys do it all the time.
But it's hard.
It's hard. If you don't know what you're doing, it's hard to implement.
Totally, totally. You know, it's interesting, Shannon, when our kids are very, very young, when they're babies, like we tend to put a lot of stuff, we take stuff with us, right? Like we take a bag filled with whatever, right?
Yes.
But when they get to be like 2 or 3, we don't do that anymore. And the truth is, with children on the spectrum, it's very useful if you have a set of stimuli in the car, so that if you want to change the subject, you can. There are you can like hold something up and say, we're going to talk about this now. The next thing, talk about that, or give them items. I'm looking around the studio and there's toys. A million toys here. I guess you've been doing the toy drive.
Oh yeah, we've been doing the toy festival of toys.
Yeah.
But I always talk about the zipper bag. My mom made a zipper bag that had different zippers, and it was just like this big. It looked like a makeup bag, but it had zippers. And each pocket had a different little toy. And so if we went anywhere, to a restaurant or a doctor's office or whatever, it was my antecedent modification.
Exactly.
That I would pull out one toy at a time. And they were little wind-up toys, because that's what he liked. And there was a little monkey that would do backflips. It would last 2 minutes, and then we'd put that away, and then I'd take out the putty.
Exactly. And it's amazing how effective it is if you have some stuff with you. Yeah. And that's all you have to do.
And it was just that big, tons. It doesn't have to have zippers everywhere. But the key was not taking it all out at the same time.
Definitely.
One toy at a time. I remember you talking about being on the plane with Charlie and how you had, now you can't do it because of, the metal detectors, but you had presents, little toys wrapped in foil on the plane.
Yep.
And that then they would have to...
all of them actually, because like as they grew up. So every time, it's hard for kids to open foil, right? Yeah. And so It would literally take 30 minutes, because sometimes I had 11-hour flights with the kids,
Yes,
you know?
yes.
So you have to have stuff to keep them busy.
I
Yeah.
love that. And now you could just wrap it in paper. Paper still takes a while to undo,
I wonder
but I
if
love.
foil would go through.
I
It's
don't think you
aluminum.
can take things
No?
wrapped in foil. I have a feeling that's
I'm going to have to test
that would
that
be
now.
a long thing at the thing. What do they call
Security,
that?
security
the
check.
checkpoint. Susie wrote in and said, my son is constantly asking, what time is it? What should I respond?
Oh yeah, that's a very good. Let's teach him time. Let's teach him time, because and this is actually kind of an interesting thing as well. Whenever a child, so let's say your child asks for what time it is, and you turn that into a whole education about clocks and time. I promise you, he will stop asking what time it is.
Yeah.
And in the meantime, because it has resulted in a very effortful sequence of
Yes.
events, which means, oh God, now I have to learn something. And it's beneficial, right, to
Yeah.
teach him time. So usually, depending on his age, Susie, I don't remember your son's age.
I think he's 5.
5, I thought
Is
so
he?
too,
I
yeah.
think so.
Yeah, so one of the things I would do is I would maybe get him a digital watch. They're hard to find nowadays, those old Casios or something.
Walmart
Yeah, or
has those.
Time,
They're cheap.
they're awesome.
Yes, yeah.
And so
9, he's 9. Why did I think he was
9.
5? He's 9.
Yeah, I don't know. I thought 5 too for some reason. Yeah, definitely, Susie. Get him like a digital watch, and so if he asks you, tell him to look at his watch, I assume he knows the numbers and he can start looking at it, and then there's a lot of stuff you can do from there on. By the way, so you can. Take the times, the various times on his watch, and associate them with activities, so that you can say, like for instance, he'll say, "What time is it?" And you'll say, "It's 7 o'clock," and it's 7 in the evening or something, and then you can then ask him, "What do we do at 7 o'clock?" Like
Yes.
it produces time. Teaching time is amazingly powerful. Because not only does it associate to events in the day and it increases language, but it also, one of the incredible things about time is it allows us to be patient. So if a child says, when are we getting there? You can simply tell them, oh, look at your watch. Right now it says 7:30. We're going to get there when it says 8. Like, it's amazing. It gives your child an anchor for the amount of time they have to wait. And waiting is one of the hardest things for kids. So
adults,
teach
it's hard
time.
for all of us.
Yeah,
It's
teach
hard.
time. It's very useful.
Parker has written in, and Parker had written in earlier
Yes.
this morning, said that he has COVID. He says he got the COVID from a coworker. And bless your heart, I love how honest you are. Parker says, I want to make her work life hell. My family and friends, my boss especially, are afraid I might act out due to this. How do I not do this? And should I not get revenge on this coworker for giving me COVID and making me miss 5 days of pay?
Oh, yeah. I'm so sorry that you're missing time at work, Parker. But, the other thing about you that I admire, Parker, is how you analyze your own behavior, and you are very self-aware, which is a very good skill. And, COVID is not, it's like you have to think about COVID as any other disease, I guess, contagious disease that we get just by being around other people. It's nobody's fault. This is an airborne disease that is out there, and your coworker did not do this intentionally. It's unfortunate that you're missing 5 days of work, but that person also probably missed many days of work. They certainly don't want to bring harm upon you. You're talking about doing some kind of harm to them intentionally. And remember, as a general rule in society, we never, no matter what happens, we never do intentional harm to anyone. Whenever you feel like, I'm so angry, this is kind of like taking the knife to school.
Yeah.
Whenever you feel like you're so angry at someone, you have to sit and really focus on why you are being so angry. What is it inside you that is causing this level of anger. It could be in your particular situation, it could be that you think they did it intentionally. Okay, well, here you go, change that, because that's a belief that is incorrect, right? This is all about, when I talk about anxiety, depression, anger, all the different feelings that we have, these are often because we have belief systems that are just incorrect, right? They're not the right belief system. And if you believe that someone is intentionally trying to hurt you by giving you COVID, then of course you're going to be angry. But if you understand that it was accidental, it was not intentional, the person didn't even know maybe that they had COVID, so they were at work, you came close to them. None of this has to do anything with that coworker, right? And if you remember that the coworker probably also suffered, also was sick, then your anger will start to turn into sympathy and empathy and realizing that people are all the same. And she probably felt upset because she got it from someone, or he got it from someone else. Exactly. And so COVID is not something that, it's like having the flu, it's like catching a cold, it's like anything else that is just in our environment. And imagine, that's for yourself. That's for analyzing and becoming aware of your own emotions. Now, for a moment, imagine what the world would be like if everybody took revenge when they were angry. Yeah. And that's the other side of this, which is like, revenge is not a positive or useful type of emotion. And I know you, Parker, you were working very, very hard on trying to be so aware of your own emotions that you only really exercise and express positive ones in the environment. This is a great opportunity for you to learn how to take your anger and look at it in a different way so that you don't feel angry, you feel compassion, and move forward from there.
Yeah. I want to point out that he said not physical, he would not do physical, but emotional harm.
Yeah.
But wanting to inflict emotional harm against someone else, I think you recognize, Parker, that that's not your highest self, that's not really who you are, which is why you've written and asked for help about it. Yeah. I also want to say, too, that I think both of us, I don't want to speak for you, but I think you and I talked to this, there's a wonderful woman, Byron Katie, who writes some pretty amazing stuff about loving what is. I love that book about hers. And one of the things that when I'm really, really, really mad about something, she has this 5-step process where you turn things around. But the main point of it is that you write out what it is you're mad. I'm mad because this coworker gave me COVID, right? And I lost 5 days of work. But then to say, okay, the first thing you have to do is say, is it true? Mm-hmm. Then you have to write the opposite of it.
Or you have to put yourself in the driver's seat.
Well, the next thing is, the way I do it is, but the first thing, is it true? And then you write the opposite. This coworker did not give me COVID.
I gave me COVID.
Well, you'll get to that. The way I do it is later. But in any case, this coworker did not, and then you have to say, is that true? Because do you actually know, like, that this person gave you COVID? There might be a kernel of truth in that. Then you turn around and you say, you take everything that you said about them and you have to put yourself in it and say, I gave me COVID and I'm so mad that I'm missing 5 days of work because of it. And you say, is that true?
Yeah.
But then you got to turn it around again and think to yourself, now you have COVID, Parker. Right now you have COVID, and it's possible that maybe somebody in your house or somebody you love is going to come down with COVID, and we're not going to be sure, was it you that gave that, and you didn't mean to.
Yeah, exactly.
You totally didn't mean to. And you're going to feel guilt about that and be like, oh no, you know, somebody I love got COVID, and I totally didn't mean for that to happen. And when you sit with all of those different emotions and go, oh, they probably didn't mean to give it to me either. For some reason, for me, that's when I go, oh, I've done the same thing and I didn't mean anything bad. And for me, that helps me.
Absolutely, absolutely. And you know, Parker, a lot of times you write to us and you are so self-aware that I honestly think you would benefit from just therapy.
Yeah.
I don't say that to everyone, but you're someone who I feel like every time something goes on in your life, you're very, very good at bringing it up analyzing it, really thinking about it. I know others who are like that too. And I feel that you might, if you found a good therapist who you could have a conversation with once a week, it would really help you with all these situations that occur. It would allow you to analyze your thoughts and feelings and overcome them fast and learn from them fast, as Shannon was saying.
And he says that he does see somebody, and he saw him yesterday, but not again until January. But also he says that his stepdad got COVID, and I see that you say that he got it from you, but you assume that. We don't know 100%. He probably, was exposed to many people besides you over the last couple of days.
And also, let me throw something else at you here. There's a positive side to getting COVID. You will now be very immune to it for the next 6 months. And no one in your household has to get the vaccine, because you're going to have very high immunity, and you can go to places where perhaps others who wouldn't go because they're concerned about getting COVID. So, I mean, it's just part of life.
And it's not great to miss 5 days of pay, but you also got 5 days of rest.
Yes.
And I believe that, I lost my keys on Saturday. I couldn't go anywhere on Sunday because I had no car keys. And I was like, well, it's a day of rest.
Yes.
And sometimes that's the only way I get a day of rest.
And where were the keys?
We still have not found them.
Oh, no.
Oh, yes. I have no key to the door here.
Oh, no.
It's not good. We're still looking. Okay. Susie says that she just ordered a Spider-Man watch from Amazon. We'll keep you posted. I love that you got Spider-Man. That's wonderful. I want to go to Esther. Esther wrote in several different parts here. She said, my son is on the spectrum and currently in ABA. His cousin is also on the spectrum, but his family is in denial about it. They are both 4 years old. Recently, we were at the cousin's house, and my son was playing with some toys, and his cousin came and took them and laughed while my son cried. I want the cousins to spend time together, but I don't want my son to learn these behaviors. What are your thoughts, and what do I tell my son? Thank you.
Yeah, these are great opportunities, as I always say. We have to look at these situations. Wonderful that you have the cousins. I would start by talking to the parents and saying, hey, is it okay if we get our kids together so that we can actually start working on certain behaviors and helping my child understand various things. And this is what happens with all kids, right?
Yes.
And it's I look at it as an opportunity to teach both sides, our kids how to handle those types of scenarios, and the other kids how to be nice and, share and turn taking. And there's all of these types of things occur only when we have the opportunity to bring them into our daily lives. So I see it as a wonderful opportunity as long as you're the parents of your child's cousins are okay with it. I would bring them in more and actually be present and work on things like sharing, turn taking. And that actually leads to all the stuff we've been talking about, Shannon, which is how someone feels when something is taken away from them, how, it's important to see things from someone else's perspective. All those things come in when you work on this.
I was raised by passive-aggressive people. So I'm a card-carrying passive-aggressive person. But so we taught our son, all in the interest of developing his language, right?
Yeah.
That when you're playing with another kid and they're doing something, you very loudly language it. That you go, you're taking my toys and that's hurting my feelings.
Right.
And that calls the attention of it. It's very passive-aggressive. But it calls the attention, and that you do this at school too. Why are you kicking me? Right? That it calls, everybody looks and goes, whatever, that you language whatever is happening.
I like it. I like that idea.
Really? It's okay?
No, it's totally okay, because that's actually very good. Like, it's not passive aggressive at all. It's good because a lot of times I've noticed kids, when they are being bullied or when something happens, I mean, in this scenario, it's not even really being bullied. It's just another child grabbing a toy.
Yeah. But then the laughing at the crying is
that's not good. And so that's why I was saying, like, in a scenario like this, it would be important to have an adult present who can redirect and work on things right then and there.
Like, bring your BT.
Yeah, bring your BT if you have a BT. But the reason I like what you said is because there are scenarios where kids when a child becomes a victim, they freeze and they become quiet.
Yeah.
And learning to say something very loud is a very protective thing.
Yeah.
And so there's a really good aspect to that. I like that.
And sometimes when you're dealing with parents who are in denial about the things that their kids are doing, the other thing that I remember doing many years ago was there was a little kid who was always mean to my son, always. And it was just a matter of catching him doing it, and then I caught him twisting Jem's arm.
Oh my gosh.
And I said, that makes me so sad that you just did that. And he kind of looked at me. He expected me to punish him or tell his mother. And I knew that if I told his mother, it was not going to happen, right? And I said, it makes me so sad because we so love coming here.
Yeah.
And I so love getting to be here with you and having my son play with you. But if you're going to hurt him, we won't ever come back.
Right.
We won't ever come back again. Is that what you want? And he said, no, I want you to come. And then he never hurt my son again.
Yeah.
But I had tried like 3 times
Yeah.
to report to the mother and nothing. She was like, oh, they're just boys. They're just, and you know, whatever.
Yeah, that reminds me of that scene in This Is 40 with Melissa McCarthy.
yes.
You know, where
I love that show.
oh my God, that's one of my favorite films as well.
Me too.
Where the mom goes and actually bullies back the child at school. That is so funny.
Yes, I had to stop my husband, who's Santa Claus. I had to stop him once because we found out that there were 3 kids that were bullying, and they're not supposed to tell you, but they did tell us. And we went, like 2 days later, we went to an assembly, and we were there, and he was like, "Which one are the 3?" I was like, "I'm not telling you. I'm not telling you which ones." He's like, "Show them, point them out to me." And I was like, "You need to stand down.
Yeah.
These are little kids. They're just like trying to set a hierarchy.
Yep.
It's not about them, and it's not about." And he was like, "Which ones? I just want a couple of minutes with." And I was like, who are you?
And then he's such a big man. It would be
he
so
is.
scary for a
He doesn't
child.
realize, but he has the kindest heart. But boy, he wanted to meet who those 3 7-year-olds were.
That's hilarious.
Oh yes,
That's
so we always
hilarious.
laugh at that movie. Okay, I want to get to a question that somebody wrote in. How about challenging behavior? How can I get my son to stop pulling my hair and his little sister's hair? He is deeply impacted, nonverbal, and does not understand that he is hurting us.
Yeah, so this is you know, again, that's why I always want to be very careful about the advice I give, because we don't know the level of functioning of the children.
Yeah.
If it's a child who has the ability to understand cause and effect, it's one thing because you can start to explain that to them. But when it's a child who doesn't have the concept of cause and effect and is just, then it's a rule. Then it's just not, it's just a behavior that is not allowed. You don't need to go into why it's not allowed, because the child really just won't understand that. And it's really a very simple, if you do this, you will not get a reinforcer, but if you do something else, you will. And that's, I'm really glad that question came up, because I want to talk a little, like what we've not talked about this entire hour is the function of challenging behavior. And the topic today was challenging behavior and what does it happen. And so I do want to just do a 2-minute quick kind of review of how, as behaviorists, we look at challenging behavior. This might be an example of that.
Yeah.
So when something happens that is a challenging behavior, no matter, and we define challenging behaviors as things that are challenging to others and to oneself. So this could be, you know, hitting, biting, spitting at, pushing, grabbing an object to someone else or to ourselves, or running away, like all these types of behaviors that are challenging.
Right.
The first thing we do as behaviorists is we ask, why is that behavior occurring? What is the reason for this behavior? And all behaviors are controlled by things that occur before them and things that occur after them, all behaviors, so including challenging behaviors. So there's always an antecedent and a consequence. And these two things, the antecedent and consequence, are the reason for that behavior occurring, right? They maintain that behavior. Challenging behaviors for parents, the first thing you have to do is think, this is communication. When a challenging behavior happens, the very first thing you do is you ask yourself, what is my child trying to communicate? What is my child trying to communicate? If my child had language, what would he be saying instead of doing this behavior? The way we find the answer to that is to list all the antecedents, things that happen right before it, and list all the consequences, and then kind of look at how they're interacting with that challenging behavior and why that behavior is happening. I'll make it really, really simple and say there's just two reasons that challenging behaviors happen. Either we want to gain access to something, or we want to avoid something. All human behavior. You want to get something or avoid it. The things that you might want to get are an object, a toy, attention, being able to run outside in the playground, a food, watching TV, all the things we want to get, right? And for instance, you might grab a toy because you want to get that toy. You might push a child because he's standing in front of the TV that you want to watch. You might bite someone because you want their attention. So this is all stuff that you want to get, or stuff that you want to avoid. So for example, I'll ask you to do something and the child will scream, tantrum, because they're trying to avoid doing that behavior.
Or run out of the school.
Or run out of the school because they want to avoid that situation. So it's always about trying to get something, which is usually an object, an activity, or attention, or trying to avoid something, which we call escape-maintained behavior, okay? And then there's the third category behaviorists look at, which is essentially ritualistic self-stimulatory behavior, which basically means it's some internal function, it's some intrinsic thing that's maintaining the behavior. Self-stimulatory behaviors are a good example of that. Why does a child engage in looking at a ceiling fan for hours, or why do they do this? And there's some internal a consequence that is satisfying enough that the child will continue to do this. It's a whole different discussion. But when we look at challenging behaviors, once you have identified, is my child trying to gain something or avoid something, that gives you the ability to replace that challenging behavior with the appropriate communication to make the same thing happen. So if I'm trying to gain something, instead of hitting you, can I say, give me that toy? Can I say just toy? Can I point to an icon that says, I want the toy? And then I get it. But I won't get it if I hit you, right? Or if I am biting you because you just asked me to do something and I'm trying to avoid it, can I just ask for a timeout? Or can I ask for a break instead of biting you? Because when I bite you, you won't give me a break. But when I give you an icon for a break, or I say all done, then you do give me a break. So that's really, really important. That's the kind of key to challenging behavior. A lot of times people overcomplicate this and try to figure out how it doesn't make sense to me. It's always just find out, is your child trying to gain access to something or avoid something? And how can I teach them to do that in a more adaptive way and give them everything they want when they do it in that more adaptive, appropriate way, but not allow them to get the result they wanted when they act out. Yeah. That's the key to everything, you know?
It sounds so simplistic though, but people miss parts of it. Like for instance, we were talking about extinction before, that if somebody's they're doing something to get attention. Like let's say they're spitting on their hand and smacking you with it, and it's found that they're doing that for attention.
Yep.
And then we say, okay, we're going to ignore that behavior and we're not going to give attention for that. People often miss the other part of it. This child needs attention.
Yes.
So we're going to teach them and give them
A
attention
different way
for
to get
other ways to
attention,
get it.
correct.
So what they tend to do with extinction is only ignore the thing and not give the attention. And so this is where a lot of critics of ABA come forward and go, if a child is looking for attention, why aren't you giving them attention? And
Yes.
I'm always there going, no, you're missing the part where you're supposed to be giving them tons of attention for things that they're doing that aren't spitting on their hand and smacking you in the
Exactly.
face. It's so
Exactly.
key that if you don't get both, you have to fulfill the need that they had.
Yes.
But you have to stop giving them what they wanted for the thing that was challenging. And if you don't get both parts of that, you've missed the boat entirely.
Absolutely. And to complicate it more, most behaviors, or I'd say the majority of behaviors, have more than one function.
Yes.
So if the child is spitting on their hand to get your attention, it's also possible they're spitting on their hand because they enjoy the sensory aspect of it.
Yes,
And you
yes.
kind of have to deal with all the functions.
Yeah.
Because if you don't give them attention and you give them attention for something else, they might still spit on their hand because the sensory aspect is rewarding enough.
Yes.
So that's what makes it very, very hard, and that's why sometimes I say it's important to have an expert, a behavior analyst, who can help you identify. And let me tell you, I've been doing this for 45 years, and I still sometimes struggle with figuring out ways to give the child what they want for a different behavior. It's hard. But that's the idea of how you deal with challenging behavior.
But I find that the most fascinating part of it.
It is. I agree.
Like, as a parent, once I got that, and it took me years, you guys, it took me years to get that, to go, okay, so how would we solve that if we know that this isn't true, this and this are true? How do we give him what he needs in a way that really works for him?
Yeah.
And that, to me, is the fascinating part about what draws me to ABA.
Absolutely. And you realize, Shannon, like, if you look at so many different things in life, right? Like, they all can be kind of traced back to this very concept. Like, I'll give you an example. I was reading an article recently about how there are a lot of new drinks that are being made that are non-alcoholic drinks, but they kind of give you a buzz in some way due to having like large amounts of niacin and whatever else.
Right.
And these are being used now for people who have a problem with alcohol dependency. And if you think about it, it's exactly the same concept.
Right.
Like, the individual with alcohol dependency is so connected and dependent on trying to get that buzz.
Yes.
That it's very hard to eliminate, like, give them a different thing that'll get that buzz.
Yeah.
Now they've produced that different thing. It's very interesting how, if you look at anything else, if you look at work behavior, like people who go to work, why do we have all these different kinds of compensation and bonus plans? It's because we're giving them what they want, their reward based on appropriate behavior. So ABA is infused in our lives, and we just don't recognize it.
Absolutely, although we should. We really should. We're just about out of time, but I will address, Parker says, I wonder why there's a lot of food aversions. I follow a family that has an autistic son whose aversions are so bad he requires a feeding tube. Is there a way to prevent feeding tubes from happening?
Parker, that's a great question. And, feeding tubes only happen when there's so much food aversion that there's loss of weight and it becomes a dangerous situation. I agree with you, though, because getting someone off a feeding tube is very hard because they actually forget how to swallow. And it's a whole thing that has to be taught. So very, very difficult. But if people were able to work on feeding skills earlier, before it gets to a point where, and we've had a lot of children who came in and were extremely selective in their eating. And there are lots of ways where you can broaden the selectivity. We can talk a different day about why food selectivity even occurs. But yes, there are behavioral ways to broaden food selectivity into just normal diet so that you never have to end up with a food tube, with a G tube,
Well, we want to thank all of you for being here with us and for writing in your questions. That's the most fun part about this, is when we get to talk to you guys virtually.
Yes.
But for those of you who are listening to this later on or watching it later on, we want you to be a part of the fun too. We want you to know that you can write in questions, follow-up questions, or just start a new question at any time. You can send that to us. You can go to drdoreen.com and you can pick the contact us, and you can write in a question there, or you can write directly to me, Shannon at autism-live.com. Shannon, SHANNON, at autism, everybody knows how to spell that, hyphen, that's the dash in the middle, live, L-I-V as in Victor, E as in elephant.com. And we're happy to answer your questions. That's all we have time for today, but thank you so much.
Such a pleasure. Thank you, and thanks everyone.
Thank you. Until next time, give your kiddos a hug from me and one for you too. Bye-bye for now.
Bye, everyone.
Don't forget, you can watch Ask Dr. Doreen live every Tuesday morning at 10 a.m. Pacific time. We hope to see you there.